Hi, this is Dr. Fox, and let's talk about the extraocular muscles. In this video, we'll discuss the extraocular muscles, their attachments, actions, and innervations. Extraocular muscles are found within the orbit, and they are any muscles which are extrinsic to the eye, connecting either the bone of the orbit or a common annular tendon at the apex of the orbit to either the eye or the superior eyelid. Most of the extraocular muscles are going to affect movement of the eye itself, and an efficient way of describing this is gaze, or the direction of vision. A lot of these muscles have very sort of straightforward actions based on how they're arranged, but when you actually get into the details of how they work, their actions then appear to be much more complex. A lot of this complexity of action is because the orbit itself is so irregular. Now recall that the orbit is rather pyramidal in shape, with its apex being more posteromedial. And as an effect of that, when muscles contract, there's going to be different vectors to consider with respect to their contraction. So, for instance, the superior rectus muscle may ostensibly have quite a straightforward action in that it would elevate gaze. Well, when we look at the direction of the superior rectus muscle fibers, we'll see that there is a portion of those which are, elevating gaze, but then there is also a portion of those which are adducting or moving gaze toward the midline, as we'll see. Now, all of the extraocular muscles are innervated by one of three cranial nerves. So either the oculomotor nerve, cranial nerve 3, the trochlear nerve, cranial nerve 4, or the abducens, cranial nerve 6. So let's get into the details of each individual extraocular muscle, starting with the oddball, the levator palpebrae superioris muscle. As its name suggests, this muscle is going to elevate the superior eyelid. It takes its proximal attachment at the apex of the orbit on the bone. Its distal attachment is on the superior tarsal plate of the eyelid. And we can see a little bit of that muscle and its tendon there. When fired, the levator palpebrae superioris muscle is going to elevate the eyelid. So it's rather a simple action there. It's innervated by the oculomotor nerve, cranial nerve 3. And as we've discussed earlier, there is a small, rather special component to this muscle. There's a little bit of smooth muscle as part of the skeletal muscle belly that's known as the tarsal muscle. And as you may recall, smooth muscle is not innervated somatically, it's innervated autonomically. And these tarsal fibers are innervated by sympathetic fibers coming from the superior cervical ganglion of the sympathetic chain. So with a sympathetic response, the muscles, the tarsal muscles contract, and the superior eyelids are pulled a little further superiorly. Now let's make our way into the extraocular muscles which will affect gaze. And let's begin with a rather unique muscle, the superior oblique muscle. The superior oblique muscle takes its attachment from the bone at the apex of the orbit, and its belly is going to run along the medial aspect of the superior orbit, and then its tendon is going to run through a structure known as the trochlea. Recall the trochlea is attached to the trochlear fovea of the frontal bone, and the tendon then moves across. Here we can see the tendon there, and inserts on the sclera posterior to the attachment of the superior rectus muscle. Now, owing to the fact that the muscle has this rather interesting circuitous route through the orbit, we can guess that there are a couple of interesting actions that result from this. First of all, the superior oblique muscle is capable of intorsion. Intorsion is a special movement that is more of a rotation of the eye toward the medial pole. So the superior pole goes towards the medial pole of the eye. So just a little bit of rotation, not a tremendous amount. We can contrast this with extorsion, which is the exact opposite movement. But the superior oblique muscle is the major driver of intorsion. In addition to intorsion, the superior oblique muscle also abducts and depresses gaze. So abduction is the movement of gaze laterally, and depression is the movement of gaze inferiorly. So we have this abduction and depression of gaze, complements of superior oblique muscle. Now, this muscle is unique in its innervation. It is the only extraocular muscle which is innervated by the trochlear nerve. And this is kind of a blessing for us because the superior oblique muscle is innervated by the trochlear nerve, cranial nerve 4, and its tendon goes through the trochlea on its way out to attach to the globe of the eye. So it's a little bit of nomenclature, sort of simplifying facts of the superior oblique for us, which is great. Next up, superior rectus muscle. Superior rectus muscle is going to take its origin from the common annular tendon, as all of the rectus muscles do, and its distal attachment is on the sclera at the superior aspect of the orbit. Superior rectus muscle appears to have a simple action, and that is the elevation of gaze, and that would be correct, but it also has the adduction of gaze. So it moves gaze slightly medially. So elevation and adduction of gaze. And in addition to this, so here we have elevation and adduction. So we've got both vectors there. In addition to this, the superior rectus muscle also has a minimal action toward intorsion. So both of the superior muscles, superior oblique and superior rectus muscles, are responsible for intorsion. Superior rectus, like most of the extraocular muscles, is innervated by the oculomotor nerve. Now let's look at the medial rectus. The medial rectus, like the superior rectus, takes its origin or proximal attachment from the common annular tendon, and its distal attachment is on the medial aspect of the sclera. Medial rectus muscle has the most simple action of, well, it's tied for the most simple action of all of the extraocular muscles, and that it just adducts gaze, meaning it moves gaze medially, as we can see here. So toward that medial canthus of the eye, and it is innervated by the oculomotor nerve. Now let's look at the lateral rectus muscle. Again, proximal attachment or origin is in the common annular tendon. Its distal attachment is on the sclera, sort of lateral here on the eye. And when it fires, it is going to abduct gaze. So it is going to pull gaze laterally. hence the name lateral rectus. It's found laterally, and it laterally moves or adducts gaze. This is another beautiful play of words here. Because the lateral rectus abducts gaze, they named the cranial nerve 4, the abducens nerve. So when the abducens nerve fires, gaze is abducted, complements of the lateral rectus muscle. And then rounding out the rectus muscles, we have the inferior rectus muscle. Its proximal attachment or origin, yep, you guessed it, the common annular tendon. Its distal attachment, the sclera, on the anterior aspect of the eye. As you may guess, owing to how the orbit is situated, how it is it's kind of a slightly inverted pyramid, the inferior rectus doesn't just depress gaze. It also depresses and adducts gaze. So depression and adduction of gaze is one of the actions of inferior rectus muscle. Extorsion, so the lateral movement or rotation of the eye, is another of its actions. So depression and adduction of gaze and extorsion. Now you might have realized that the other adductors of gaze include not just the medial rectus, but the superior rectus as well. So inferior, medial, and superior rectus muscles are all adductors. So that's one thing to consider. The lateral rectus is the unique one among that in that it is an abductor of gaze. The inferior rectus muscle is innervated by, yep, you guessed it, oculomotor nerve, cranial nerve 3. And that leaves us with the inferior oblique muscle. The inferior oblique muscle takes its proximal attachment on the orbital surface of the maxilla and its distal attachment up on the lateral aspect of the sclera, just kind of inferior from the lateral rectus muscle. And when the inferior oblique muscle fires, it is going to elevate and abduct gaze. So it's going to move gaze upwards and outwards. And it is also responsible for extorsion, so that sort of lateral rotation of the eye on its axis. So the two muscles responsible for intorsion are the inferior rectus and inferior oblique muscle. So if it has inferior in its name, it extorts. Whereas if it has superior in its name, superior rectus or superior oblique, it's responsible for intorsion, among other things. And finally, the inferior oblique muscle is innervated by the oculomotor nerve. So let's do a quick review of the extraocular muscles, their innervations and their actions. So let's start with levator palpebrae superioris, because it's the only one that doesn't attach to the eye. It's innervated by the oculomotor nerve, cranial nerve 3, and when it fires, it's going to elevate the superior palpebrae. Now let's look at the rectus muscles. Superior rectus, medial rectus, and inferior rectus are all innervated by cranial nerve number 3. Boop, boop, boop. And they all have some component of adducting gaze. So medial rectus purely adducts gaze. Superior and inferior rectus also adduct gaze or move gaze medially. The superior rectus muscle also elevates and is responsible for intorsion. The inferior rectus muscle depresses gaze and is responsible for extorsion. So intorsion, if you recall, is complements of these superior muscles, superior rectus and superior oblique, whereas extorsion is complements of these inferior muscles, inferior rectus and inferior oblique. Superior oblique is unique in its innervation. It is not oculomotor nerve. It is the trochlear nerve, which we can remember because its tendon goes through the trochlea, which attaches to the trochlear fovea. And then the other uniquely innervated muscle is the lateral rectus muscle. Lateral rectus is innervated by the abducens muscle, cranial nerve 6, and the abducens nerve, when activating lateral rectus, abducts gaze, or moves it laterally. So that leaves us to the assessment question of the video, which is, a lesion of the right abducens nerve, cranial nerve 6, may most significantly impact which movement of the eye? Is it abduction, adduction, depression, elevation, or intorsion? Well, you know that the abducens abducts, so that makes this a very easy question to answer. Adduction of the eye would be, in its most pure state, the medial rectus, although there are also components of superior and inferior rectus. That's not it. Those are all innervated by 3. Depression of gaze would be inferior rectus or superior oblique. So that would be 3 or 4. Elevation of the eye would either be superior rectus or inferior oblique. So that would be cranial nerve 3 as well. And intorsion would be either the superior rectus or superior oblique. So either 3 or 4. So that's not right. The only action that 6 performs is abduction. That's why A is the correct answer. Thank you so much for your time, and I'll talk to you in the next video.